For the next couple of slides, we're going to talk about two very important areas of the brain, and these areas are related to the production and the perception of language, so they're pretty important for this topic for this chapter. The first of these areas is called Brocas Area, and so this is all going back to when Dr. Broca was treating a man who had been kicked in the head by a horse. So this is a case study, a single individual who experienced a pretty severe trauma, and at first it didn't seem like he had suffered any lasting damages, but as time went on, his condition worsened, and eventually he lost his ability to produce speech. And the only thing he could say at the end was the word tan, so he came to be known as Patient Tan. Now, when someone has difficulty or is completely unable to produce speech, we'll say that they have aphasia. That's what we would classify that. In this specific situation, this individual had what we now call Broca's aphasia, which is difficulty with the motor production aspect of language. So he struggled with physically producing the movements and the sounds that allow him to produce language. This is also referred to as non-fluent aphasia because he's unable to produce words and sounds fluidly as he would need to. And after this individual had died, Broca was able to look at his brain and determine where he had suffered most of the damage that would then be associated with his loss of speech. So most of the damage was focused sort of here in this greenish colored area, so mostly on the frontal lobe and the lower area. So that's now called Brocas area. And they assumed that this was associated with his inability to speak. And there were two things that we learned that were very important coming out of this case study. The first of these findings is that there seems to be an area of the brain that's controlling speech. So that's the area that we now know as Brocas area. The other thing that we learned was that language production appeared to be controlled by the left hemisphere. So in this situation, our patient Tan was only injured on the left side of his brain, and yet that still impacted his ability to produce speech. And future sort of case studies and other experience, we've found that most people, in fact 9 out of 10 people, have what's called hemispheric lateralization of the control of language. And so when we talk about hemispheric lateralization, we're really referring to the fact that some functions, in this case language production, are mostly controlled or dominantly controlled by one hemisphere of the brain rather than the other. So most people have their language controlled in the left side of the brain. And the people who don't have it controlled in the left side of the brain, it's sometimes right dominant, but more often than not, it's actually sort of diffused and equally spread between left and right hemisphere. But that's sort of special cases that go beyond the span of today. The other important area of the brain that we want to talk about is called Wernikes Area. So in this situation, it's kind of the pair to go along with Brocas area. And in this case, Dr. Wernicke had a patient who could produce speech, but the speech they produced was nonsense. So they weren't making any sense, but they could do the motor functions that were involved. So this would be called Wernicke's or fluent aphasia. So they're having trouble with the meaning, but not with the motor function part of it. In this case, the patient had suffered damage to their temporal lobe, so on the side of their head, also on the left, so still in line with that idea that language seems to be controlled on the left side of our brain, and this area seems to be responsible for speech comprehension. So whereas Brocas area is responsible for producing the actions and that motor component of speech, Wernicke's area is involved in comprehending and sort of putting together meaning along with speech. And so if we can look at the orientation of both areas together, The current idea is that Wernikes area, along with other areas of the temporal lobe, help contribute to processing and differentiating between different sounds. And then they pass information along to Brocas area, and Brocas area is responsible for forming a response or for communicating something back. So there seems to be sort of this movement between between Wernikes area and Brocas area, and that is sort of the very basicest form, or most basic, of our language system, at least in terms of production.